Hi class. This week's discussion will focus on unionization and its impact on nursing. The nursing field has evolved over the years to meet the needs of our society. However, there are certain aspects that continue to plague our profession, including inadequate staffing, pay discrepancies, and unsafe nurse-patient ratios. Because of these conditions, unionization was incorporated into the nursing field to protect nurses from poor treatment. For the purpose of this discussion, the National Labor Relations Act will be reviewed along with nursing considerations regarding unionization, the pros and cons of joining a union, and what implications this may have with the nurse-management relationship. From our textbook, Contemporary Nursing, the National Labor Relations Act was founded by Congress in 1935 to protect the rights of workers during the unionization process without fear of retribution from employers. Since its debut, revisions have been made to the National Labor Relations Act, excluding nurses employed at nonprofit hospitals from forming unions and requiring a written notice 10 days prior to a strike or picket. Nurses have the right to join and form unions, as well as discuss unionization outside the workplace when there is felt to be a significant need. Employers may not intimidate nurses into voting against unionization, whereas unions are not to use scare tactics in obtaining support from employees. Prior to providing support towards unionization, nurses should ask questions such as, how would unionization affect my workplace relationships with non-union personnel? And will unionization improve the workplace and overall patient care? Nurses considering unionization should weigh the pros and cons before coming to a decision, as this will significantly impact the workplace as a whole. From our textbook, Contemporary Nursing, advantages to the formation of a union would include possible wage increases, better benefits, advocacy for safer work environments, and representation during employee evaluations. Whereas cons of unionization include union dues, tension between unionized nurses and other non-union workers, and the potential for patient care to suffer. According to an article within Nursing Leadership, unionization within nursing has not shown improvement in one area of concern, which is workplace violence against nurses. One goal of unionization is to ensure nursing safety. However, instead of working with management to incorporate strict policies against workplace violence, unions continue to follow the zero tolerance approach, which is not working, and nurses continue to face threats to their safety from unruly patients. Despite opinions regarding unionization, nurses and management should work together in attempts to create a better work environment. Communication is key in any healthy relationship. Nurses should feel comfortable expressing their concerns to nursing supervisors without fear of retribution. As an employer, practicing compassion and active listening during meetings shows employees they are in a safe place. Another way for nurses and upper management to connect is for management to actively engage with employees and voice their desires to improve upon workplace morale while encouraging recommendations from staff. Despite the potential for discord within the workplace, nurses should not feel threatened by their personal decision to unionize due to the fact there is the National Labor Relations Act, which states nurses do have the right to unionize. However, employees may be subject to hostility and scrutiny from their non-union peers. Also, nurses can face termination as long as their employer is able to prove the reason is not related to unionization. Overall, there are many factors that go into this decision, and the benefits must be weighed with the possible risks. I hope this discussion has been helpful in identifying some of the main points on this subject. Thank you very much.